Hi, I'm going to share my transition plan for my client. So, some background. Akai is a 91-year-old Japanese American who recently experienced congestive heart failure with an ejection fraction of 20%. Akai was living alone in a Japanese assisted living facility community where he was the ombudsman. He was experiencing shortness of breath, fatigue, and confusion. And so he was brought to the hospital where he was diagnosed with the congestive heart failure. His comorbidities include CAD, hypertension, atrial fibrillation, diabetes, stage 4 chronic kidney disease, osteoarthritis, and he has had both his right and left hips replaced. Akai was admitted to subacute rehabilitation facility for 21 days to receive OT, PT, registered nursing, and social work services. His greatest needs, as he stated, were to return to the assisted living facility and to be able to care for himself. Upon admission to the subacute rehab facility, Akai required minimal assistance for upper body dressing, total assistance for lower body dressing, mod to max assist for hygiene, max assistance in supine to sit, maximal assistance for transfers with the use of a rolling walker, and required verbal cues 50% of the time to maintain proper hand placement on the walker. He also required moderate assistance to manage his medications. His goals were to complete lower body dressing with moderate assistance within 7 days. Within 2 weeks, the client will demonstrate improved safety and independence during transfers with the use of a walker and moderate assistance. And within 2 weeks, the client will manage medications with minimal assistance. Now, at the end of his 21-day stay, his current level of functioning is that he can perform lower body dressing with adaptive equipment, safely use his walker and understands how to use it, and he can manage his new medications with the use of a weekly pill planner and an organizer. His current impairments and barriers that he's experiencing endurance limitations, fatigue, and decreased activity tolerance. He requires frequent rest periods during tasks, and he has been learning energy conservation techniques and how to monitor his symptoms. The client is currently transitioning out of the subacute facility that he has been at for 21 days. He is being discharged to his assisted living facility. He's being transitioned home because he has met all of his goals and has a good understanding of his current health status. It is recommended that he receive in-home OT services to support his transition home. So the recommendations for the transition back to the assisted living facility are as follows. So receiving home health occupational therapy services will really support him through the transition. It would also be important to have an OT do a home evaluation to assess the safety of the environment for the use of a walker, as well as to assess how he can best utilize the energy conservation techniques at home. It's also important to educate the nursing staff at the assisted living facility about his status and any new and changed medications. And then it's also important to ensure the appropriate application of the educational strategies he learned regarding energy conservation and symptom management, and then ensuring he has the appropriate and necessary supports at the assisted living facility to help him function safely.